Okay, so what if I told you that the phone in your pocket could one day help spot one of the deadliest forms of skin cancer way before it's too late? It sounds like science fiction, right? Well, we're going to dive into a powerful new AI that's poised to totally revolutionize the fight against melanoma. And believe me, the results are, well, they're pretty incredible.
So let's just start with this number, 95%. That right there is the survival rate for melanoma, but only if you catch it in its earliest stages. It just goes to show you, in this fight, timing isn't just a big deal, it's literally everything. It is the line between life and death.
And that 95% figure, it really throws a spotlight on a tough reality. When it comes to melanoma, you are absolutely in a race against the clock. So let's break down why that clock is ticking and why it's ticking so incredibly loudly.
All right, so here's the wild thing about melanoma. It's a total paradox. Get this. It only accounts for about 1% of all skin cancer cases. 1%. But, and this is the scary part, it's responsible for the majority of skin cancer deaths. It's just so aggressive, which is why catching it early isn't just a good idea, it's pretty much our only real weapon against it.
But, and this is a huge but, that's where the problem is. The way we diagnose it now can be agonizingly slow. You know the drill, right? You notice a weird spot, you get in to see your primary care doc, and then the waiting game begins. You're waiting for that specialist referral, waiting to finally see a dermatologist. And those wait times can be weeks, even months. Every single one of those days is another day that this cancer could be spreading. It's a huge, critical gap in the system.
So the big question is, how do we close that gap? How do we speed things up? Well, this is exactly where technology steps in, with a potential game changer, the AI dermatologist. This is the new tool designed to help us actually win this race against time.
So, how does this AI actually compare to a human expert? I mean, look, a dermatologist's experience is absolutely priceless. But they're human. There are only so many of them, which leads to those long waits we talked about. But an AI platform, like the one being developed by Medical Care Technologies, Inc., can give you an analysis almost instantly. And here's the really mind-blowing part. Under experimental conditions, its accuracy is right up there with, and sometimes even beats, the top human experts.
Okay, so how does it actually do that? It's not magic. The secret sauce is something called convolutional neural networks, or CNNs for short. Think of it like this. It's a type of AI that's just fantastic at understanding pictures. It's been trained by looking at these massive public photo libraries, like the one from the International Skin Imaging Collaboration. It's basically seen hundreds of thousands of skin lesions, learning, just like a human doctor, to spot the telltale signs, weird borders, changes in color, a larger diameter, all the red flags.
And I just want to pause on that for a second, because this is huge. This isn't just about being faster. The data is telling us that this technology can perform at the absolute highest level. This is a tool that could, potentially, put an expert-level diagnostician in every single doctor's office, no matter where you are in the world. The implications are staggering.
But of course, it's never quite that simple, is it? As amazing as all this sounds, with any technology this powerful, there's always a flip side. You've got all this promise, but it comes with some serious peril. So now we have to get real about the tough challenges and the very tricky questions this whole thing brings up.
And check this out, because it's not just about the AI performing like an expert on its own. It's about how it can make everyone else better. The data shows that when you give this tool to, say, a medical student or a nurse practitioner, their ability to spot melanoma correctly just skyrockets. It's like giving them a super smart assistant, and it could be a massive equalizer, lifting the quality of care for everyone.
And yet, here's the real tension. You can show people all the data in the world, but there's this deeply human thing we can't ignore. At the end of the day, there's a fundamental gut-level trust that we place in human doctors over machines. Both patients and clinicians feel it. There's just this hesitation, this fear about handing over such a life-or-death decision to an algorithm.
And you know what? Those concerns are 100% valid. I mean, think about it. An AI is only as smart as the data you feed it. So what happens if those huge data sets don't have enough images of darker skin tones? The AI could be less accurate for a whole group of people. And what about your private medical data? And then there's the biggest question of all. If the algorithm makes a mistake, who's on the hook? The doctor who used it? The company that built it? These are massive hurdles we have to figure out.
Yeah, that last question. When an algorithm is wrong, who's responsible? That's really the heart of the matter, isn't it?
It's a total legal and ethical minefield, and frankly, we're just taking our first steps into it. There are no easy answers here, which is exactly why this is a conversation we need to be having, like, right now. So, we're stuck between all this incredible promise and this very real peril. What does the future actually look like then? How do we take this amazing technology and get it out of the lab and into your doctor's office safely and responsibly?
Well, for one thing, this isn't going to just pop up at your next checkup. The road from a cool idea in a lab to your local clinic is a long and winding one. It all starts with more R&D, then it moves into intense real-world testing. After that, it has to get through all the red tape from regulators like the FDA. And even then, it has to be designed to fit perfectly into how doctors and nurses already do their jobs without messing everything up.
And this is a really key point, so I want to be super clear. The goal here is not to replace doctors. It's not about firing dermatologists and plugging in a computer. It's about helping them. Think of the AI as a powerful checker, right? A digital second opinion. It gives the human doctor more information, more confidence in their diagnosis. But the final call, that and the all-important human connection with the patient, stays right where it belongs, in the clinician's hands.
Which really brings us to one final, pretty heavy thought to chew on. As we bring these amazing, powerful tools into our healthcare system, we have to keep asking ourselves this question. Are we building a future for medicine that's more accurate and more efficient, but maybe, just maybe, a little less human? It's the big question we all have to wrestle with as we walk into this incredible new age of medicine.